And we've got a welcoming word from the Minister of Health. Unfortunately, he was not able to join in person, but he sent a pre-recording. I believe.
Thank you, Program Director, distinguished delegates, community leaders, researchers. It is a great privilege to welcome you all to Cape Town for the 30th International Conference on Health and Hepatitis in Substance Users. We are deeply honored to host this important gathering, the first time it is being held on the African soil. On behalf of the Government of South Africa and the National Department of Health, I extend our warmest welcome to each of you. Drug use is a pressing contemporary issue. We know that all drugs use carries health risks. Hepatitis C, HIV, overdose, and other physical and mental health conditions significantly affect people who use drugs. Many of these conditions can be prevented or effectively managed through evidence-based public health interventions. At the same time, people who use drugs often experience high levels of incarceration, exclusion, violence, and stigma. An effective public health approach must therefore be rights-based, inclusive, and firmly rooted in harm reduction. In South Africa, an estimated 400,000 people use opioids, and a similar number use methamphetamine or cocaine regularly. We estimate that around 82,000 people inject drugs, and we acknowledge ongoing hepatitis C and HIV epidemics among this population. Hepatitis C prevalence among people who inject drugs ranges from 50% to over 90%, and between 1 in 3 and 3 out of 4 people who inject drugs are living with HIV. Many live with both infections, and most know someone who has died from a drug-related overdose. Urgent action is needed. Our commitment is clear. 3 key national policies: the National Drug Master Plan, the National Strategic Plan on HIV, TB, and STIs, and the National Viral Hepatitis Action Plan envision the elimination of HIV and viral hepatitis as public health threats by 2030. Evidence-based harm reduction and human rights are central to these policies. The National Essential Medicine List Committee recently reviewed the inclusion of methadone for opioid agonist therapy, or OAT, on the national formulary. Following this review, the National Essential Medicine List Committee recommended a pilot study be undertaken to assess the feasibility, acceptability, effectiveness, and sustainability of providing OAT services within community health centers before national rollout. To support implementation, the National Essential Medical List Committee developed a non-essential medicine list, non-EML protocol for mental health conditions. Opioid dependence, guiding the safe and standardized use of OAT in pilot site. The project will also apply the World Health Organization guidelines on psychosocially assisted pharmacological treatment of opioid dependence. The opioid agonist therapy pilot project will be implemented in Mpumalanga Province, Emarasheni Sub-District Community Health Center, also in Northwest Province, Madibe Sub-District Community Health Center. The primary objective of the pilot is to generate evidence on the feasibility and sustainability of integrating opioid agonist therapy into routine primary health care. The findings will inform the incremental national rollout of opioid agonist therapy and contribute to the expansion of comprehensive harm reduction services in South Africa. Currently, the Department of Health is not implementing the needle and syringe program, as illicit drug use is still criminalized. Needles and syringes are provided by NGOs who are supported by development partners. Through implementation of the development partners, needle and syringe and opioid agonist therapy services are now provided in 11 health districts across 5 provinces. In the second half of 2024 alone, over 27,000 people who inject drugs were reached through needle and syringe services. Nearly 3,000 received opioid agonist therapy, and around 200 were cured of hepatitis C infection. The Department of Health continues to lead the world's largest HIV program, with over 5 million people receiving antiretroviral therapy and almost 2 million on pre-exposure prophylaxis PrEP. Direct-acting antivirals are included on the tertiary level essential medicine list, and our capacity to manage hepatitis C is steadily increasing. We support innovative research and novel models of care, and we are working with our regulatory authority and industry to improve access to affordable medicines. Colleagues, while challenges remain, the opportunities before us are significant. The science is clear, and the public health care is compelling. Now, more than ever, we must strengthen our collective action across countries, across disciplines, and across systems. We must also ensure that people who use drugs are not only beneficiaries but active partners in the design, implementation, and evaluation of the program. Let this conference be a platform to share the latest research, innovative models of care, and lived experiences. As South Africa hosts this important global dialogue, we recommend to building a more inclusive, integrated, and resilient public health system, one that leaves no one behind. I thank the International Network on Health and Hepatitis in Substance Users for partnering with us to make this conference a reality. I also thank our local researchers, clinicians, activists, civil society organizations, and people with lived and living experience of drug use, whose frontline work is changing their lives every day. I wish you a productive, evidence-rich, and solution-focused conference, characterized by robust discussions. May our time together move us closer to a healthier, fairer, and more just world for people who use drugs. I thank you.